Welcome to the ASC podcast with John Goehle, a weekly podcast for anyone interested in the freestanding ambulatory surgery industry. This week's episode is sponsored by Ambulatory Healthcare Strategies, one of the nation's leading full-service ASC regulatory compliance consulting firms, and the Regulatory Compliance series of books for ASCs by John Goehle and published by Eden Group Development.
Welcome to episode 12 of the ASC podcast with John Goehle for March 19th, 2018, recording from our studio here in Rochester, New York. This is Jenna Alvarez, Senior Nurse Consultant with Ambulatory Healthcare Strategies. I'm here with Sue Cronkite, also a Senior Nurse Consultant with AHS, and John Goehle, one of the nation's leading ASC industry experts. He is the author of over 10 books about the ASC industry, a very sought-after speaker about ASC financial and regulatory issues, an ASC developer and administrator, and now the owner of Ambulatory Healthcare Strategies, one of the nation's leading ASC financial and regulatory oversight firms. Welcome, everyone.
Good morning, John.
Good morning.
So, everyone's voices are mostly back this week, and we've been working on fixing our microphone problems throughout the week.
Yes, Sue spent, it seems, most of Sunday doing the editing of of last week's podcast. I know we had some serious problems. Most of what you were doing, though, was removing what?
A lot of coughing, a little bit of dogs barking and running around.
That's the problem, allowing dogs into our studio here. They're fun, but they do need to be quiet. Understand that, dogs? Quiet. Sit. Okay. We also had a major microphone problem last week, which unfortunately we didn't realize until post-production. And that is for the microphone that I am currently speaking from, apparently decided it had its own agenda and kind of messed up our podcast a little bit. So we've done some research. I am actually able to do research still. I know Sue is our main research person, but I figured out the problem and we've been able to adjust it. So hopefully we're sounding a lot better. Also, we really have been making some major changes. We all have brand new mic stands, as a matter of fact. How does everybody like their mic stands?
It's working good.
Yeah, mine's great. But John, what is that huge monstrosity right in front of you?
Well, the problem is my microphone, because of course it has to be the best microphone, is also the heaviest microphone. So I've got like 6 pounds of weights holding it up. I mean, I hope I don't move too much because I think the thing will fall on top of me and probably do some serious damage. But hopefully this will help make our lives a little bit easier. Now we can just sit in front of our microphones and talk. Mm-hmm. So one of the things that we've been getting feedback from, Jenna, is that some of our listeners have pointed out that they really need to kind of keep everyone informed about what's coming up in the podcast so that we can have an ongoing, everybody's prepared for the next topics, and also to keep them excited about all the topics that we're going to talk about. And indeed, this week's podcast, I think, will be our best so far. So do you want to give it a shot?
Sure. So this week on ASC Podcast with John Goehle, we're going to discuss news and information about what's going on in the ASC industry. We're going to talk about how to deal with ASC leadership changes, how to hire new staff and leadership, how to prepare to be a leader for those interested in this area. And in our last segment, we will discuss outsourcing of services. Also, reminder to our listeners to tell their friends and to make sure they hit that subscribe button. Our audience is growing steadily, and the more it grows, the more we can do.
Sounds good. I think we got them all excited.
John, let's start talking about your week. It was certainly a busy one. Can you tell us a little bit about that?
Certainly. So I traveled again all over the East Coast this week. I was down at the ASC Association headquarters in Alexandria, Virginia, for the meeting of the Board of Ambulatory Surgery Certification. I am the current president of the board. My term ends at the end of June. I think most people know, as I laughingly say, I missed one of those board meetings one day and I got elected president a couple years ago. That's not really true, but that's the story that I like to tell. But I am the outgoing president, and we have a new one coming on board. Very excited about all the things that are going on. So during our meeting, we talked a lot about the CAPE credential, which is the new infection prevention certification that is being developed by the Board of Ambulatory Surgery Certification for the infection control area. Very excited about it. We are on target. This is a very important development for the ASC industry, for the ASC Association, and for the Board of Ambulatory Surgery certification. And what's really neat about this certification is it will be the first certification for ambulatory surgery center infection preventists. We know that there are certifications out there for hospital infection preventists, but this is the first one specifically geared toward people that work in the freestanding ambulatory surgery industry. And we have spent a lot of time, an enormous amount of money, a lot of research, and we're working with really one of the nation's leading test preparation companies to prepare for this test and to make sure it's scientifically based and all those other things. So we're well on target. The first test sign-up registration will begin sometime in July, and the first test will be sometime in October. So if you're interested in what's going on, make sure you visit the About CAPE, and that's ABOUTCAIP.org website, and you can learn everything you can about it.
Exciting news.
So we're also talking at the board meeting about ASCA 2018, which all of us in Ambulatory Healthcare Strategies and on this podcast will be attending together. So we're very excited about going down there. So the ASCA 2018 is April 11th through the 14th in Boston at the Heinz Convention Center. So definitely plan to be there. Go to the ASCAssociation.org website to sign up and make sure you get your rooms now. I know the rooms are disappearing very quickly. So.
And what else did you have going on this week?
So it was an interesting week. It was kind of a week of transitions. We're noting, a number of our facilities are going through some leadership changes. We have a new facility coming on board, which is ramping up very rapidly, which has to hire an administrator and a nurse manager. So I think that became, as we were talking in preparation for this podcast this week, we decided that would be a good theme for the week. In other words, transitions, how to deal with ASC leadership changes, what makes a good ASC leader. And we also wanted to focus on the other side of it. In other words, if you are currently, a nurse or a business office person or somebody else in the organization that has aspirations to move into leadership in an ambulatory surgery center, what does it take to become a good leader, and what type of preparation needs to be done? So we decided to make that the topic through the week. And also this week we've had to deal with a brand new client who called us because they had a difficult Joint Commission survey and asked us to help them out. So learning a little bit from that. It is in the infection control area. We're not really going to deal with that topic this week, but I think next week is going to be a big conversation about infection prevention.
Now for our news and information of interest to the ASC industry. An article in the February issue of Helio discusses the risk of malpractice suit. The article notes that 34% of physicians have been sued, with general surgeons and OBGYNs having the greatest risk. Of course, many of these claims are dismissed or withdrawn, but it still takes a toll on the physician and uses healthcare dollars that could be put into improving patient care. So what can we do to change this? One key is to be transparent with your patients. Take the informed consent a step further by really involving the patient in the process. Allison Shuren, partner at Arnold & Porter, noted, shared responsibility and shared decision-making between the physician and the patient is key to minimizing risk. John and Johnny, do you have some thoughts about this?
Yes, I think the comment about informed consent is very important. Often we just take this one for granted, but making sure that the physician has done an informed consent, and preferably prior to the patient coming into the center. That's one of the issues I've found, is that many times in ambulatory surgery setting, that informed consent is obtained or is at least documented on the day of the surgery. I always ask the doctors beforehand, when we have to do this, when the surgery center has to be the one getting the signature, just give me some assurance that the patient and the doctor had this conversation in depth in the office well before this procedure was performed. And truly that is the case in most circumstances. But the importance of getting a good informed consent, of informing the patient about everything, answering all of their questions, giving them an opportunity to ask those questions, I think is critical. Sue, you're doing a little bit of work in the medical legal area. I do a little bit of work in that medical legal area. And I know that's one of those areas that there's an awful lot of literature about the importance of getting this informed consent and how critical it is to the patient.
Yes, and just making sure they're comfortable with it and that you've really explained everything and making them a part of that process.
Wonderful.
Okay, and next in our news, more of an information for our listeners as the ASC industry moves more and more towards electronic medical records or electronic health records. While the EMRs have made documenting more streamlined process, there are some things to remember. Be careful with auto-population and the copying and pasting features to ensure continued accuracy. I know I used to work in a hospital where we were allowed to copy and paste our documentation, and some people would not carefully look those over after copying and pasting. I admit I did use the copy and pasting feature quite a bit, but I would go line by line and make sure that everything was accurate. And I actually liked this feature because it let me see if there was a change from what the previous person had documented and identify those changes more rapidly. But I don't think that this was a standard throughout all the nursing staff, and I think that that's something that people have to be very careful about.
So using those tools, but using them correctly and really accurately.
I think also they talked about that auto-population function, which I think is a major problem, especially in ambulatory surgery. I can't speak to the hospitals, but one of the things I've noted as some of our centers have been coming on board with electronic medical records is that they're trying to find ways to make their doctors' jobs easier. So they're doing a lot of auto-population, and that's where you're getting into trouble. I'll tell you, one of the things that I've seen, and one of the things that we look for as a surveyor, is if a patient has been transferred to a hospital, to make sure that that operative report actually indicates that something happened, especially if that transfer happened, while the patient was still in the operating room. Or I'll find in the discharge notes that the patient was discharged home with no complications, because that was just a standard auto-populated item, whereas they were transferred to the hospital. So you have to be very, very careful with that auto-population function.
Yes. And another important thing to note is that attorneys can request the metadata, which includes information about the records and the results that were reviewed and how much time was spent doing so. So they can tell exactly how long a doctor or a nurse looked at test results before they did a procedure. And if, something went wrong and you maybe didn't actually know the results or didn't look at the results like you said you did, that could get you into trouble.
I think that in particular could be a problem with H&Ps. If the doctor, if you look at the metadata and it shows that the doctor only spent, 10 seconds looking at an H&P.
Did you really absorb that information?
Correct. So one of the challenges that I have seen with electronic medical records is that what you see on the screen when you're a provider working with a patient is very different than what is printed out for a lawyer when they're looking at it or using it as part of a lawsuit. And I think the best example of this is allergies and reactions. We all know that any decent electronic medical record system is going to have a flashing red symbol or something at the top of the screen that says that this is the allergy that the patient has and warning you. And no matter where you go in the electronic medical record, that flashing sign is going to be there the whole time. But when you print this out in an electronic medical record, that's not going to be obvious that information was readily available to everybody. So we have to be very careful about the printouts that are available or that are used to send to in law cases. And I've made this point a couple of times to lawyers that, sometimes it might be smarter to actually take a screenshot of that information rather than actually looking at it, the printout of the electronic medical record, especially if you're trying to get into the head of the provider while that procedure was going on.
So true.
Yep, there's a lot of information to be aware of when you're working with the EMRs, and I'm looking a lot more into that. I'll have a lot more research that we can talk about in future podcasts.
I think that'd make a good topic, a specific weekly podcast.
Or a premium content podcast.
That's an excellent idea. As a matter of fact, our first premium podcast is going to be coming out in a week or two, and it's going to be on governance. And by the way, Jenna, we just have signed up with BASS, the Board of Ambulatory Surgery Certification, so that we can offer AEU units for our premium podcast. So everybody out there that is CAS certified, keep an eye out for that. We'll be getting more information about that soon.
And where can listeners find information about the premium content?
So if you go to the ASC podcast website, ascpodcast.com, that has all the information, or will have all the information as premium podcasts are offered, as well as information on the AEU units that you'll be able to get for doing those podcasts.
Okay, well, we'll keep an eye out for that. Okay, let's take a quick break, and then we'll come back and discuss ASC leadership changes.
This week we are discussing transitions, specifically how to deal with leadership changes and even what you should be looking for when hiring leaders for your new ASC.
So, John, let's get started with employee perceptions of working in an ambulatory surgery center versus working in the hospital.
So I actually work with quite a number of centers that are recruiting ambulatory surgery staff from hospitals. Indeed, even some hospital physician joint ventures where they try to recruit people directly from the hospital that might have been working in a hospital environment. And one thing that I've noted over the years is that there is this perception, especially in outpatient surgery departments of hospitals, that, oh, wow, when I go to the ambulatory surgery center, my life is going to be so much easier over there. You know, this is a great thing for me to do as I start to head toward retirement because the pace isn't going to be as difficult and, you know, nothing can be as intense as working in the hospital. Well, what do you all think about that?
Not quite true.
That's right. I mean, I think we all agree that ambulatory surgery is much more intensive than the average hospital environment, simply because there's an expectation that these cases are going to be turned over quickly, that you have a different duty to the patient. You know, let's face it, in the hospital, often the attitude toward the patients is not quite the same as in a highly competitive field like the ambulatory surgery industry, where we need to make sure that we're keeping the doctor happy, we're keeping the patient happy. And of course, an ambulatory surgery center does not have the support services that a hospital has. So you're out there alone. If a patient codes, you don't call the code team. You are the code team. If a patient suddenly tells you in the post-op area that they don't have a family member to take them home, you don't call the social work department. You are the social work department. So this is a very important distinction, I think, for people that are considering moving from a hospital environment into an ambulatory surgery environment.
So, John, why is leadership turnover often such a difficult situation in an ambulatory surgery center?
I think much like the situation with employees, leaders that come into the ambulatory surgery environment are often not aware of the differences between either managing a hospital department or managing a physician's practice. An ambulatory surgery center is a highly regulated area, and you're dealing with a multitude of regulations that are not generally understood or recognized by people that are not familiar with the industry. So that makes managing an ambulatory surgery center much more complex. And yet, individuals that come into it think that this is going to be relatively easy compared to where they had been before. Mm-hmm. ASC leaders and administrators, nursing directors, they require skills in a wide range of areas, including, regulatory compliance, personnel administration, finance, quality improvement, and risk management. They need to understand OSHA and OSHA bloodborne pathogens regulations. They have to be very good at, managing clinical care, and they need to have some experience in dealing with legal affairs within that surgery center. So what we find there is that ASC leadership turnover is not at all uncommon. A couple of weeks ago we talked in one of our podcasts about we put together the scenario where the doctor was recruiting a nurse manager, and Jenna, you played, I'm sorry, not a nurse manager, I think it was an administrator. I think Jenna, you played that administrator, and I played the doctor. And what was confusing there is that the physician did not understand that an administrator was not an administrative assistant. And as silly as that sounds to us, that scenario pops up every once in a while where the physicians really do not have any clue as to the magnitude or how difficult the ASC administrator position is.
Well, let's talk about what owners and board members need to look for in an ASC leader. And also, for those of you listening who might aspire to become an ASC leader, what skills you will need to become an effective leader.
So when a leadership change occurs, ASC owners and governing body members are really faced with a very daunting challenge in selecting a new leader. Often they have a very general knowledge of what's required of an ASC administrator or a nurse manager. And the only thing that they really understand are those types of interactions that directly occur between the board member or the owner and the administrator, not understanding all those things that those individuals do in the background. So what does it take to be a good leader, as Jenna just asked? And also, I want you to think about it from two standpoints here. Both if you are a governing body member or an owner who's looking for a leader, what are you going to look for? And also, if you are an employee right now who is not in a leadership position, what types of skills do you need to strive for in order to be an effective leader in an ambulatory surgery setting? So one of the one of the foremost issues that I find is that ASC leaders cannot be afraid to confront the surgeons. And of course, this is very difficult when the surgeons are the ones that are choosing the ASC leaders in the first place. As a director of an organization or the director of nursing, they're tasked with enforcing the organization's policies and assuring the compliance with all the various regulatory requirements. And unfortunately, this is periodically going to put them in conflict with the surgeons who either don't understand, don't know those regulations, or feel that those regulations are not being interpreted properly. And a good ASC leader, a good nurse manager is going to have to be able to stand up to those things that need to be done properly in an ambulatory surgery setting. Obviously, they need to have a thorough knowledge of ASC licensure in the state. They need to have an understanding of the certification requirements, the conditions for coverage, the interpretive guidelines. And they need to understand accreditation standards if they are involved in a facility that is accredited. Understanding the ASC conditions for coverage and the various standards and regulations is not something that comes quickly to leaders. So this is something that they're going to have to study thoroughly, have to go through some additional training if they're not already familiar with it, or obviously you need to hire somebody that already has those skills coming into this position. There are an awful lot of personnel issues that occur in an ambulatory surgery setting, and a thorough knowledge of personnel regulations and the ability to lead and motivate staff to achieve the organization's goals and objectives are really one of the primary issues that we find in finding a leader. Also, a knowledge of the legal issues that face an ambulatory surgery center, including a knowledge of fraud and abuse, anti-kickback, and medical legal issues. Even nurse managers need to understand these issues since they come up frequently in an ambulatory surgery setting. Enough financial management knowledge to interact with contracted or employed financial professionals and to maintain appropriate financial stewardship for the organization. As an individual does an awful lot of training of nurses in the financial area, this is often a very difficult area for nurses to do. Most of the nursing programs today really don't have any financial management training, and this is something that usually has to be picked up after they've been licensed and, often through national training programs such as those offered by the ASC Association. Now, not every administrator or nurse manager is going to have to understand everything about financial management, but even a nurse manager is going to have to be able to understand how to manage the supplies cost, how to manage the staffing, to keep that staffing low, to understand that you need to minimize overtime if you're going to want to improve the profitability. And also how to manage a budget. So what do the numbers mean? What do those numbers in the financial statements mean to them? I don't know why I put this toward the end, but a knowledge of quality assurance and performance improvement, this really should be probably number one on that list. And development of management programs and appropriate monitoring tools. Quality assurance and performance improvement is 75% of an average survey that's performed by an accreditation organization or by the state or by CMS. So any individual going into ASC leadership has to have a very strong background in this area. And lastly, a knowledge of risk management programs, including, how to deal with incident management, how to identify and document incidents that occur in the ambulatory surgery center, what the OSHA regulations are, both the general regulations as well as those specific to healthcare organizations such as the OSHA bloodborne pathogen requirements. Now, I'm well aware that this is quite a daunting list, isn't it? And finding individuals with all these skills is very difficult. It's very difficult to hire someone with all of the skills that are listed. Often, organizations are going to find it necessary to hire more than one individual to do that, which isn't always easy in a very small organization. We, for example, in some of our clients, we have organizations that have one or two rooms and in a couple cases are only open one day a week. You certainly cannot afford an administrator and a nurse manager, and those individuals are probably not full-time anyway. So those become real challenges for organizations that are small in size. Often organizations find that they need to combine those duties, or indeed, as we're going to talk about in our last section here, consider outsourcing portions of this in order to be able to get the best bang for the buck, be able to find a more cost-effective way of offering those services or making sure all of those needs are met. Companies like Ambulatory Healthcare Strategies, for example, kind of specialize in these types of outsourced services.
So, John, where do ASC owners and board members find leaders with these skills?
Well, of course, that is the challenge. There's right now a lot of openings in surgery centers for administrators and nurse managers in particular. In the Western New York area in which we live, I know of 3 openings right now that are going unfilled because of the challenges of finding people within our own community. Most likely they're going to have to recruit individuals from outside of our area. So often it is best to recruit individuals from within and to bring people up within the organization to be able to step into these roles. Jenna, as a nurse, what advice can you give to your colleagues about preparing for the leadership role?
Well, nurses don't generally jump directly into the nurse manager role. Often there's stepping stones along the way to get there, and gradually taking on more responsibilities is a good way to do that. Joining a committee, becoming an infection control preventionist or quality improvement coordinator, and then taking on a leadership role such as a charge nurse or a supervisor. Another thing nurses can do that I think is really important is taking every educational opportunity available to them, such as taking courses on webinars, getting their certifications, attending conferences such as ASC 2018 coming up in April, and even listening to this podcast.
You know, for me, the key is finding what you're passionate about or what your strengths are and pursuing those areas. Sometimes you find a pathway that you never expected. Just be curious and always open to learning new things.
Thanks, Jenna and Sue. You both brought very different, 2 different perspectives to the issue here. So if you are a nurse working in an ambulatory surgery setting and are thinking about moving into the ASC leadership role, as Jenna and Sue talked about, avail yourselves of any of your opportunities in your organization. Be willing to volunteer for more responsibilities there. Attend training programs and national conferences. I'm going to put another plug in for ASCA 2018. And of course, as Jenna said, let's keep listening to this weekly podcast because I think one of our duties here is to prepare the next generation of ASC leaders.
And maybe even read one of your books.
That wouldn't be a bad idea either. Thanks.
Thank you, John. After the break, we will be examining other administrative structures, including the outsourcing of some of your administrative and regulatory functions.
John, I understand you have a special offer for our listeners this week.
Yes, indeed we do. So as a special offer for all of our listeners on this podcast, we're offering a significant discount on my book, The Survey Guide for ASCs, a guide to the CMS conditions for coverage and interpretive guidelines for ambulatory surgery centers. This book, as hopefully everyone knows by now, is the leading book in the industry for preparing for a CMS survey. Has a lot of information about what the regulations are, the interpretive guidelines, and really has a nice index to be able to find this information quickly. I find it's particularly helpful for those difficult questions we sometimes get from the physicians when they say, okay, show me the regulation. And they can pull this book out and go right to that section very quickly. So in order to take advantage of this deal, go to the ascpodcast.com website, which is ascpodcast.com. And follow the link for this week's episode. You will see a link to purchase the book for $30 off the purchase price, plus free shipping.
And how long is this offer available?
You can purchase this book at this discount through April 30th.
Thanks, John. So please head over to our website, ascpodcast.com, to take advantage of this great offer. Welcome back. So let's get started. John, what is outsourcing and why should we consider it?
So outsourcing is a buzzword, certainly in the business world, and it's probably one of the more popular terms right now. A lot of it came about as a result of the difficulties we had during the recession and the need to find ways to cut costs. I think it's important in an ambulatory surgery setting because we have such a wide variety of ambulatory surgery centers. We have very large centers that do a very high volume. And as I talked about in the previous section, centers that might only be open one day a week. which means that the types of leaders that you have, the types of skills that those leaders need to have, and the types of resources they have available to them are going to be very different depending upon the size of the organization and the financial resources that are available. So outsourcing is the process of looking toward having an outside company, non-employed individuals providing various services to the facility. And as companies downsize or want to become more competitive, or if they just know that they're never going to be able to hire somebody with all those skills, outsourcing becomes a very cost-effective way. It allows a company to scale without hiring any additional staff, provides expertise that you would never be able to hire yourself. It's similar to a timeshare. You only pay for the services of that individual for a part of time. For example, not many places, especially the smaller ones, can afford a $160,000, $170,000 a year administrator. But you can hire an individual that has many of the same skills that that expensive administrator might have in an outsourced basis.
What are some examples of things that you already outsource?
So I guess the most common ones are laundry and linen. We don't generally do our own laundry and linen in an ambulatory surgery center. We don't want to deal with the various OSHA requirements of doing that laundry and linen. It adds a lot of complexity to it. So we outsource that to other organizations that do it every day. They can afford, all the chemicals. They can afford all of the dealing with all the regulations that are specific to their industry. And it's much more cost effective for them to do it. Cleaning service is another area. Not every surgery center hires individuals that clean the center. So often you hire an outside cleaning company to work after hours to do the cleaning of the organization. Dictation, another example. Though dictation is becoming less and less of an issue now as we find electronic medical records that allow the physician to create an operating report right within the software, dictation still is one of those common outsourced items where you hire somebody, often an individual that might actually work out of their home, for a much more cost-effective price than having an individual that has been hired in your organization. Billing is another example of something that can be outsourced. Depending upon the size of your organization, you might not be able to hire an individual to be able to do the types of billing that needs to be done. Biomedical services, who absolutely needs to have in a smaller organization a full-time individual keeping all of your equipment up to specifications.
John, what other things might you find more cost-effective to outsource?
So as I talked about just before you asked that question, billing is one of those areas that sometimes you decide it's time to move to an outside billing company. I, in general, am not a big fan of outsourced billing for larger organizations because I think it's much more cost-effective to hire individuals to do that function. But in smaller organizations and in communities that don't have individuals that are skilled in ambulatory surgery center billing, which, by the way, is very different than billing in a physician's practice or in a hospital. If you can't find them in your community, then really sometimes the only option you have is outsourcing that to one of the national companies that has those skills. Accounting, especially, again, for smaller organizations, you probably don't need a full-time accountant who does those functions in your organization. So you might outsource that to an accounting company or accounting firm. Accounts payable, something that you might want to consider outsourcing. For example, ambulatory healthcare strategies outsources its accounts payable function because we just don't want to deal with the day-to-day business of handling all of those bills. Credentialing is an area that is often outsourced also, or frequently outsourced. I have some issues with many of the credentialing companies that are out there. I don't find that they're necessarily living up to my expectations. I'm hoping that's an area that we're going to start seeing some improvement in the quality of the services that are being offered. But it is definitely one way to reduce the amount of work that is done in-house with regard to credentialing the providers in your organization. Employee benefits, another area that we ourselves outsource to other companies, is handling the employee benefits, making sure that all of your regulatory requirements are met for your employees. And very frequently outsourced to outside organizations. And then we can start talking about things like quality improvement, like the oversight of the quality improvement program. For example, our sponsor, Ambulatory Healthcare Strategies, is well known for its providing outsourced services and oversight of the quality improvement program. Outsourced quality improvement services do not replace an individual in your organization that gathers the information, but outsourced organizations oversee the work. They develop the programs. They make sure that the programs are up to date. They make sure that the programs meet regulatory and accreditation requirements. And then these organizations summarize all the information that has been gathered on a quarterly basis, or more frequently if necessary, put together the agendas for the meetings, make sure all of the loops are closed. We'll talk about loop closure at some point in the future when we talk about quality improvement, but making sure that all of those issues that have been identified as part of the quality improvement process are dealt with and the appropriate conclusions are reached. Outsourcing organizations that deal with quality improvement can also run the quality improvement meetings in conjunction with the ASC administration and even write the minutes for those organizations. So you can see that outsourcing quality improvement can make up for the lack of an individual that has a lot of experience in quality improvement. By the way, another thing to point out about outsourcing is that many good companies, such as Ambulatory Healthcare Strategies, are not necessarily going to be the long-term solution for that. So, for example, if you run into a scenario where your quality improvement coordinator has left the organization, you can hire a company such as AHS to come in and work on a temporary basis in order to be able to fulfill that responsibility while you train a new nurse manager, a new quality improvement coordinator to do those duties. Another outsourcing area is regulatory oversight. Again, that's something that Ambulatory Healthcare Strategies, for example, does provide as a service, where you're running board meetings, you're assisting the governing body in making sure they meet all the requirements that are expected of them in the regulatory arena, doing policy manuals, updating those policy manuals, preparing educational programs, training your staff, providing, on-site educational programs through the computer. And then writing the minutes of the governing body meetings, doing periodic mock surveys of the organization, doing walkthroughs for life safety. All of those are things that are often outsourced to an outside organization if you're not able to afford or not able to find a administrator or nurse manager that's able to do all of that.
And what are some of the other advantages of outsourcing?
Well, quite frequently, outsourcing can be more cost effective. I gave the example of what happens when you just really cannot afford an administrator at a very high income level because you're so small. You really have no choice but to outsource that type of function to an outside organization. The other thing that's very beneficial is that when an ASC turnover occurs, when administrative turnover occurs, that really is not affected. The outsourced organization continues to do what they've been doing. They might have a new individual that they have to work with, but they're able to usually continue working with almost no disruption in the flow of information.
So that's it for this week's program. Join us again next week for the ASC podcast with John Goehle. And don't forget to tell your friends and colleagues about the podcast and make sure you hit that subscribe button.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all the rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute, legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development, all rights reserved. We would like to thank this week's sponsors, Ambulatory Healthcare Strategies, one of the nation's leading regulatory compliance and financial oversight firms. For a free consultation, contact John Goehle today at 585-594-1167 or through email at info@ah-strategies.com. Our other sponsor today is Eden Group Development, which publishes ASC Regulatory Compliance Series, the ASC industry's leading books, including the Survey Guide for ASCs, a guide to the CMS conditions for coverage, and interpretive guidelines for ambulatory surgery centers, and Ambulatory Surgery Center Governance, a guide for ambulatory surgery center owners and governing body members. These must-have books are available on Amazon and Barnes & Noble or directly from the publisher at reg-books.com. That's reg-books.com. If you are interested in advertising or sponsoring the ASC podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.